Welcome back to the Road to Wellness on CTV Beam. This is Dr. Stanley Himes with Edward Champagne, and we're talking about sunshine. Let the sun shine in. So we're going to be talking about vitamin D, the sunshine vitamin today. So we're going to ask some questions here, and we'll see how Edgar does and how you do there in the audience. So slide number 1, we're going to talk about how many people have blood levels of vitamin D that are either deficient or insufficient.
How many?
A is 5%, B is 15%, C is 25%, D is at least 50%, and E is 90%.
I'm going to think that it would be because of the sun, people liking the sun tans, pretty high. I would say 50% of the people don't have.
Correctamundo!
Really?
You are absolutely correct. So we're talking about 50% of the population is at least deficient in vitamin D. All right, let's go to question number 2 on slide number 3. Why do so many people fall short on vitamin D? A, they spend less time in the sun. B, they wear sunscreen. C, they live in northern areas where sunlight is inadequate most of the year. D, they are obese. E, not many foods supply vitamin D. And hint, there's more than one correct answer.
Yeah, okay. I think I like the answer C and A and C.
All of the above.
All of the above.
Right. So spend less time in the sun, particularly because people are wearing sunscreen. So sunscreen blocks out the ultraviolet light that forms a reaction on your skin to produce vitamin D in the body. Obesity, more and more people are overweight, and obese people have less vitamin D. They absorb less. They absorb less from the sun rays. The further north you get from the equator, the less UV radiation you get, and so the less into vitamin D. All right, next question. Slide number 5. True or false? Vitamin D is a hormone.
Vitamin D hormone.
True or false?
False.
True. Bing, 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 bing. So only after the kidneys convert it into its biologically active form, calcitriol, then it becomes a hormone. It can act in many places in the body. All right.
Okay. Well, I thought hormone would be something that's already in the body.
Well, that's true for the most part, but not with vitamin D, because vitamin D is converted by the kidneys.
It's a special vitamin.
It's a special vitamin. All right, next question, slide number 7. True or false? Younger people need to consume more vitamin D than older folks. True or false?
False.
True. No, excuse me, you're right. False. Older people need to consume more vitamin D because as you get older, the reaction of the sun to the skin becomes less. So a 70-year-old person makes about 25% of the vitamin D
needed,
an average as a 20-year-old from the sun. So not as efficient. So older people need more vitamin D.
Okay. Right now I got about a 40 on my test.
All right, slide number 9. The daily recommended dietary allowance of the RDA for vitamin D for most adults is A, 400 IU, that stands for international units. B, 600 IU. C, 800 IU, or D, 1,000 IU.
D. I'm going to guess D.
No, there's only 600,
Oh.
which is very low. So in 2010, the Institute of Medicine raised the RDA for adults from 400, which is very low, to 600, which is still low. And they raised the RDA for people 70 and older to 800. But I have found in supplementing people with vitamin D that you need anywhere from 1,000, 2,000, even more to get their vitamin D level up and to keep it up. Okay, so we're going to be talking about the benefits of vitamin D. I have one more question here. How much time does the average person need to spend in the sun to make adequate vitamin D?
How much time?
Okay, A, 5 minutes a week. B, 15 minutes twice a week. Or C, at least 15 minutes nearly every day.
15 minutes every day, C.
Actually, the standard recommendation is 10 to 20 minutes sun exposure between 10 and 3 twice a week to the face, arms, and legs without sunscreen. Because if you're wearing sunscreen, you're going to block it. So you don't need to spend a whole lot of time there in the sun, but you need about 15 minutes twice a week without sunscreen.
Yeah.
Okay? So, vitamin D is very interesting in that, unlike other nutrients, it works on how the genes are expressed in your body. So there are vitamin D receptors throughout the body. So there are over 200 genes that are regulated by vitamin D. So at least 35 tissues in the body have vitamin D receptors. So we're going to talk about the health benefits of vitamin D today. Okay. So what do you think are some of the health benefits, would you say?
From vitamin D?
From vitamin D.
Well, I was just listening to you talk about the 35 tissues that benefit from the vitamin D. I would think that your skin, it helps you with your skin.
Right.
I think it's going to probably help with the sweat glands because you're in the sun and it helps you keep the pores open.
No? Well, let's talk about, let's say if you're deficient, we have certain blood levels of vitamin D. Those RDA requirements for vitamin D were set based upon children, preventing them from getting rickets, which is bone problems with their bones.
Sure.
So vitamin D is very important for bone health, to build strong bones. It helps calcium to get into the bones to make strong bones. So if you are less than 30 nanograms per ml, which is a blood test we can do, you're going to have increased calcium loss from the bones. So when I check people in the office, I would say 50% of them are less than 30. Another 50% are less than 20. These people are very low. You're going to have an increased risk of diabetes. You're going to have a greater rate of depression. You're going to have increased inflammation in the body. You're going to have poor wound healing. So vitamin D is very important, and most Americans are not getting vitamin D, not getting enough vitamin D from the sun and from the fact that there's very few food sources that have vitamin D. So when we come back, we're going to talk about at more depth about the health benefits of vitamin D. And we're on the road to wellness on CTV Beam. And I'm Dr. Stanley Himes with Edgar Champagne. And we will see you shortly after this break.
Everything starts out small. The things that hurt us, they all start from somewhere. The words we say, the things we do, they can grow into something else. What was small and innocent can become big and sometimes scary. All it takes is one comment, one picture, one video for something to catch fire. But a big problem doesn't need a big response. Not at first. Even if we don't know what to say, the eye emoji can be that first step we take. Let's all pledge to take that first small step together and change the world in a big way. I'm a witness, and so are you.
Welcome back to The Road to Wellness on CTV Beam with Dr. Stanley Himes. I'm Edgar Champagne. We're talking about vitamin D and the benefits of vitamin D. Dr. Himes, several benefits like diabetes, fighting depression, reducing asthma, balance, immunity, and strengthen your bones, brain power. Let's start with diabetes. What's the benefits?
Well, we're going to show the slide here where it talks about the health benefits of vitamin D, slide 11. Your risk of diabetes is lowered if your vitamin D level is optimal. And I usually tell people we shoot for 60 to 80, which a lot of traditional medicine people think is high. But we have found through various studies that that is the optimal level. So vitamin D decreases your insulin resistance. So that means the insulin can work better to get the glucose into the cells. A lot of people are insulin resistant that are diabetic, particularly if they are obese. Obesity and fat, particularly around the mid-range, and as you get older, that's where it goes. That causes an increase in insulin resistance, so vitamin D helps that. It helps insulin to work better.
Okay. What about fighting depression?
So we know with vitamin D that people who have very low vitamin D levels have a very increased rate of depression. So if you look at the world map, as you're on the equator, those people very close to the equator, north and south, have very higher levels of vitamin D because of their UV radiation. They have the lowest rates of depression in the world, all over the world if you look at that. As you get further and further north, you get less UV radiation, and the reaction of the sun creating vitamin D becomes less and less and less. So if you go up to somewhere like Alaska, for instance, they have a much higher rate of depression. The Scandinavian countries, they're very high in, I guess it's latitude. They're not getting as much sun, so they have a much higher rate of depression.
Canadians?
They have a higher rate than people further south.
I see.
So very important. So that's where you heard the term winter blues. During the winter, the daylight time is much, much, much shorter. So we get much less sun during the winter months. So it's very hard to get an adequate amount of vitamin D. And so you've heard of the winter blues and people are down. So people say in Alaska, they have to have what's called light therapy so that they don't get so depressed, because the days become so short that they're not getting enough vitamin D, and their rate of depression goes up much, much higher.
Let me ask you to put your science jacket on for a moment. Would a vitamin D sun inducement be better in the winter or summer? I mean, is there a certain amount? The vitamin D we get from the winter months, is it different from June?
Yes.
And July? It is different?
Yes. And we're going to show that. Well, maybe we can show that slide now. Slide 18 shows the amount of vitamin D synthesis in February, and to give an idea of a winter month.
Okay.
And you can see from this that all the blue is areas that can't get enough vitamin D. And so basically, most of the United States, you can't get enough adequate vitamin D during the winter. As opposed to slide 19 is September, and you can see that a good part of the United States gets adequate amount of vitamin D, particularly in the southern areas. Here in the south, we get plenty of sun. And that sun occurs from 10 till 3 o'clock.
10 to 3.
10 to 3.
Those are the optimum times
Those are the
too.
optimum times.
That's when I'm
to
on the
get
golf
that.
course. Working on my tan. Okay, let's
Working
go.
on your handicap.
How about reducing asthma?
We know that vitamin D reduces the severity of an asthma attack and reduces whether people with asthma get upper respiratory infections, people who have adequate optimal levels of vitamin D. We know that in pregnant mothers, higher vitamin D birth babies have a 40% decrease in asthma.
Oh.
They've shown that.
Okay, that's a special vitamin. Well, you were telling me as we talked on the phone getting ready for the show that it balances your immune system as well?
That's right. So vitamin D is an integral part of your immune system. So people who have low vitamin D have a much higher rate of Hashimoto's thyroiditis, which is a hyperthyroid problem, Parkinson's disease, multiple sclerosis. So we have a slide here that shows, having to do with multiple sclerosis, the fact that the further you get from the equator, the further north you get, the higher rates in the world of vitamin D deficiency.
The world.
In the world. So vitamin D is very important to your immune system. So if you have a low vitamin D, you're going to get more colds, you're going to be sicker, you're going to be able to fight it off. Your wounds will not heal as well or as fast.
That's great.
So one of the things that I would do in my office is to give people IV nutrition before surgery and after surgery. And you found that people, and a primary part of that is vitamin D and other vitamins. You will notice that you will have less pain, your wound, your surgical incision will heal faster, you have a lower infection rate, and I'm here to tell you that it works. I've done it on myself, I've done it on patients, and it's great.
You're on the road to wellness with Dr. Stanley Himes. We're driving down the road. Strengthening bones. Vitamin D can actually strengthen your bones.
Absolutely. Vitamin D is very important for strong bones. I think you may have heard that. A lot of the commercials are talking about milk say, well, drink milk so you can have strong bones because of the vitamin D. So the reason they're saying that is not because the milk has it in it, they're adding vitamin D to the milk. If you look very closely, it says fortified with vitamin D because the pasteurization process of milk kills all the vitamins. So any vitamins in it, you have to add it to it. So vitamin D prevents breakdown of bone. It helps calcium get into the bones. It gives you stronger bones. And then let's talk about your brain. Vitamin D is essential to a healthy brain. Vitamin D is linked to low levels of vitamin D are linked to decreased memory. So vitamin D is, people who have low levels of vitamin D, we've noticed that it will double the risk of Alzheimer's disease. So vitamin D in the brain is very important.
Brain. So that means, according to what you were saying a while ago, and when we were taking the test, when they were asking me those multiple choice questions, if a person is out there between, well, the requirement, according to the Medical Association, you should be out there maybe 15 to 20 minutes twice a day, maybe.
Well, twice a week.
A week. Now, so
where your hands, your face, your arms, and your legs are exposed
the PGA, for example,
without sunscreen.
the PGA and the lady golfers, they're out in the sun a lot.
Yes.
I'm in the sun a lot because I love golf.
Right.
And lifeguards are out there in swimming pools and everything.
Right.
But they probably have the sun guard, lifeguards, but still, I mean,
Remember, if you wear sunscreen, you're going to block the reaction.
you cancel it out.
You cancel it out. You're blocking the UV rays because the reason to wear sunscreen is to prevent skin cancer, and that's the question. But we're talking about a relatively short amount of time
Yeah.
in the sun in order to get that vitamin D. The other thing I want to note is that the darker your skin color, the poorer the reaction is of the sun converting those sun rays into vitamin D. So people of color, African Americans, have significantly lower vitamin D levels than fairer skinned people.
If we stay in the sun longer, does that help, or it will not?
It will help some, but still the reaction just is significantly reduced. So,
I see.
and that I think is one of the reasons why you see higher rates of certain types of cancer in African Americans, whether it be colon cancer, other vitamin D sensitive cancers. And maybe we can talk about that in the next segment about vitamin D and prevention and reducing cancer because it has a significant effect.
Well, I feel smarter when I play golf from being in the sun because it boosts your brain power, but I'm sure that's not why.
Does it boost your handicap though?
No. On the road to wellness with Dr. Stanley Hines, we're going to be right back with more information about vitamin D and other things on this show at CTV Beams. You stay with us. Dr. Hines will be right back.
When it comes to saving money,
What? Harry!
don't act like a baby.
Oh, it's like they're having their own little meeting. This is so humiliating.
Be the boss
I'm the boss.
What the?
Power nap. You were saying.
and make a budget.
Let's get to work.
Need a little help?
Stacy, read back the notes.
I can't read. What's it say?
Create a personalized savings plan and get other tools and tips
We can share.
You obviously didn't go to business school.
at feedthepig.org.
Welcome back to the Road of Wellness. We're driving down that road with Dr. Stanley Himes on CTV Beams. I'm Edgar Champagne. We're talking about vitamin D, and Dr. Himes, there are more benefits to vitamin D than people actually realize. So many. Like, for example, fighting cancer improves your fertility, protects the heart, decreases inflammation and all that. We're going to run down that list. Let's start with how it fights cancer, vitamin D.
Right. People with optimal rates of vitamin D have lower rates of certain types of cancer. Breast cancer, colon cancer, ovarian cancer, prostate cancer, pancreatic cancer. So it seems like vitamin D blocks blood supply to tumors, stops cancer cells from metastasizing, and keeps the cell division process of cancer cells from getting out of control. And we have a slide that shows that vitamin D reduces the risk of cancer. It also reduces the risk of lung cancer, bladder cancer, and we talked about the other types of cancer. People who have optimal levels. So one of the things we do in a wellness practice with people who have cancer is to make sure that their vitamin D is at an optimal level. A lot of times the chemotherapy that people are under, their nutrition is not as good and their vitamin D will get really, really low. So one of the things that we do is to make sure that their vitamin D is optimized.
Women may not know this, but it improves fertility. Talk about that.
Right. So when we talk about fertility, it will improve in a women their sex hormone production, estrogen, progesterone, testosterone in women. In men, it increases sperm motility, optimal levels of vitamin D. It can increase healthy pregnancy rates, having an optimal level of vitamin D. So very important with fertility, with men and women.
How does vitamin D protect your heart? That's interesting.
Well, we don't quite know exactly how it protects the heart, but we know that when you do a study and people have optimal levels of vitamin D, that they have a much lower heart attack rate and stroke rate.
I see.
Just if you just keep vitamin D optimal levels, change other things, their levels of heart attack and stroke are much less. So it has a protection of the heart. So we have a slide there that shows that it can protect the heart.
I see. Okay. We're talking about vitamin D on the road to wellness, driving down that road with Stanley Himes. Dr. Stanley Himes is going to get us there. I understand that it can decrease inflammation. That's like swelling and what have you.
Well, when we talk about inflammation, the picture I get is that, you know, if you have a swollen knee, you hurt your knee playing basketball or football or something, and it's redness, there's inflammation there. That's what's going on inside the body. And we think that that's what's causing a lot of this chronic inflammation internally is what's causing chronic disease, high blood pressure, diabetes, even obesity, stroke, heart attack. Vitamin D decreases this inflammation. So when we were talking about diabetes before and insulin resistance, a good part of insulin resistance is that the fat cells release inflammatory cytokines into the bloodstream, causing this increase in insulin resistance. Vitamin D reduces that, makes the insulin more sensitive and reduces inflammation internally. So when I was talking about giving people vitamin D intravenously before surgery, that reduces inflammation. I think that's why people's wounds heal faster. That certainly happened with me when I had surgery.
I see. Okay. And for athletes, it'll enhance your physical performance and activity?
Increases optimal vitamin D levels will increase your physical performance, and this is particularly important in older people. You will have better balance, because one of the concerns as you get older is that you fall and break your hip, and that's bad in an older person. So people with optimal vitamin D levels, the studies have shown that it will decrease falls by 20%.
Well, what's the vertigo? Is that affected? Does vitamin
Vertigo, no, I wouldn't say that. Vertigo is kind of a imbalance. And we could talk about that on a later show. As far as I had a real problem with vertigo, I would get up from the bed and I would just lose my balance and all that. Went to a traditional doctor. They gave me the Meclizine, the Antivert, the medicine for the vertigo. It didn't do anything. They did test anything. So I went to a functional medicine doctor who is a neurologist, and they took care of me. They got the semicircular canals in my ear straight, and I got over that vertigo.
Yeah.
But we're talking about vitamin D.
Okay, we're talking about vitamin D, but okay. Well, how does it improve your sleep? Vitamin D.
Studies show that if you have optimal vitamin D levels, it improves your sleep quality.
Sleep quality.
So we talked about sleep, I think, last week, and we talked about REM sleep and the fact that you are rejuvenated in that deep sleep. So it looks like optimal vitamin D levels, you have more REM sleep, and so you get better sleep quality.
Okay, then. And lowering your blood pressure, vitamin D can lower your blood pressure.
If your
Optimal
vitamin D level is low, you have a much higher blood pressure. So it can lower your blood pressure. It can also, as far as sexual health, can improve your libido, your sexual desire. People who have low vitamin D levels, they have low sexual desire. So vitamin D, there are vitamin D receptors all over the body. It's amazing, all the things that it does.
You're talking about the 35 tissue receptors anyway.
That's right.
Yeah, okay. And it can influence or help with chronic pain, vitamin D.
Right. It can help with muscle or bone pain. So we know that vitamin D improves your bone health. And people who have bone pain, it can help them. And also when you're talking about digestion, we're going to talk at a later show about the bacteria, the good bacteria in your gut. It helps them flourish in your gut. So there is a barrier in your gut of the barrier wall, and it promotes integrity of that barrier so that you don't have the stuff coming into your system causing autoimmune problems, autoimmune diseases.
Yeah.
And we also know that people who are deficient, people who have ulcerative colitis and Crohn's, they will have more flare-ups. So if they have an optimal vitamin D level, that would help them with their inflammatory bowel disease.
But can you expound a little bit on the pain in the muscles?
I don't know why it does, but it does.
It does?
Yeah.
Okay.
I don't know why it does, but it does.
Well, something that bothered me that I think, because I used to pop my knuckles as a young boy, and the decrease in inflammation and all that, it seems like my hands swell if I eat some salmon that's seasoned really spicy, or some hot sauce or something. Like my hands will swell up, and that's a form of inflammation, I think, isn't it?
Can be, but I tell people that spicy foods are good for you. So I don't quite know why your hands are swelling up.
Yeah.
Maybe there's something you're having an allergic reaction to in what you're eating there.
I see.
But spicy foods are good for the body.
Okay. On the Road to Wellness with Dr. Stanley Himes, we're talking about vitamin D. Coming up in a segment just not too far away, we're going to be talking about sugar. And it's called the sweet side.
On the sweet side.
Yeah, we're going to talk about that.
Yes, Lord. Sugar is my weakness. I love me some sugar.
Yeah, but today we're talking about vitamin D. Now, kind of give us a recap of what we've talked about in terms of the main thing that we need. There's a certain amount of time we should be getting sunshine.
Right.
And you really can't go and buy vitamin D across the counter.
Well, you can. You can buy supplements. But you cannot. I think you need to go to a functional medicine doctor, and they will give you vitamin D that is pharmaceutical grade, which is very important.
Right.
And I think you need to be under the care of a physician if you're going to take supplements, because if you're taking a vitamin D supplement, you have no idea how much you need. So we do a blood test and monitor it and make sure that you're at the right level. So vitamin D is very important in all of these systems as far as your heart, your bones, your brain, your sexual hormones, your energy, controlling blood pressure, preventing diabetes and making diabetes better. But next week we're going to talk about sugar.
Yeah.
And added sugar and the love affair that Americans have with sugar. It is amazing how much sugar that we eat in our diets.
And not really know it.
And not know it, and the negative effects that sugar has on our health. Primarily diabetes and heart health, particularly the heart.
You're driving down the road to wellness with Dr. Stanley Himes. My name is Edgar Champagne. Next week, on the sweet side, we'll talk about sugar. And remember this, in order to be healthy, this guy can get you there. We're on the road to wellness. Thanks for watching on CTV Beam.